What's the most unprofessional thing a doctor has said to you? I was refused birth control once because apparently it's a decision my husband needed to be present for, because we could want kids. Nothing permanent, just birth control. Christ. Audiologist told me I just thought I was losing my hearing because I hang around too many deaf people and that I need counseling. I have Meniere's disease, verified by actual doctors. As someone with hearing loss, the amount of trash audiologists is astounding. Went to my doctor with allergy-related shortness of breath and she asked me when my last menstrual cycle was. At the time I was on a hormonal BC pill prescribed by a different doctor about 6 months prior that I took in 3-month cycles. Having my period every 3 months instead of monthly. I told her it was 2 months prior and before I could start to explain, she cut me off, rolled her eyes, and said, "Oh, so you're here for a pregnancy test." I was insistent that I was having trouble breathing and that I was on the tail end of a 3-month pill cycle. So she reluctantly ordered some breathing tests and told me, "Don't worry, I'm going to give you the test." I was not pregnant but I did get diagnosed with RAD and prescribed an inhaler that day. Edit forgot to add that under the treatment notes she sent me home with. She added that I needed to consistently take birth control pills to increase the effectiveness and avoid further scares. My dentist, while performing a root canal. Oh, wow, that's quite a lot of blood. And in response to my muffled sounds of concern about that statement, "Oh, don't worry, you have very nice blood, it's a wonderful shade of red," it did not make me feel any better about the situation. 2 occasions. Same dumbass doctor. I was like 12 and I got a skin infection in my back and he just blatantly told me it was that disease where fish have to eat the dead skin and that it had no cure and was gonna get a lot worse. Being a kid I was heartbroken by that, especially when told in such a blunt way. Anyways, my mom took me to another hospital and they were shocked at how dumb the other guy was. Obviously wrong diagnosis. It was something really easy to treat, and how he could just blurt that out to a kid. Second time. I was about 15 and got a swell in the R-tip of my penis and he just started screaming and calling his colleague and started pointing at it and crap. If I was embarrassed before, you can guess how I felt after. It fixed itself after a while anyways. No thanks to that moron. When I was in middle school I was getting sick every day, coming home from school to vomit for hours, go to sleep and repeat. This went on for about a week or so before I finally went to my doctor. Upon getting there, the only thing my doctor did was put that ear scope thingy in my ear for a few seconds. He then asked if I was telling the truth and told my mom I was faking it to get out of school. A few days later we found the cause. The underside of my bed was covered in mold. Luckily we found it when we did. There's no telling how sick I could have gotten. I have hated my family doctor ever since and refused to go back to him. Stop coming to me all the time. It is all in your head. Well, he wasn't wrong. It's all in my head. That's why another professional and good doctor sent me to a psychiatrist when they confirmed that my digestive system is perfectly fine. All the pain and discomfort I felt might be due to one mental illness. A few years ago I went in for a routine physical, and I had also asked for an STD test. I had no reason to think I had anything. I always used protection. I didn't have frick anonymous, and as far as I knew, I hadn't been exposed to anything. I was just trying to be responsible, and it's always good to be sure. On the day of the physical, the doctor was friendly, pleasant, and professional. He was wrapping up the exam and finishing the paperwork, but he hadn't mentioned the STD test at all. So I said, "Oh," and I also asked for an STD test when I made the appointment. His mannerisms changed immediately. He went quiet, and his shoulders tensed up as he hunched forward over his paperwork. I wasn't aware of any need for an STD test. It was very clear that he was all of a sudden uncomfortable being in the room with me. He filled out the paperwork for the tests, begrudgingly handed it to me, and gruffly said something like, "You should be fine as long as you don't get involved with any nasty habits." The judgmental and confrontational attitude was bad enough, but it was worse watching his manner completely change in an instant, and being treated like a different person at the end of the exam than I was at the beginning. All I did was bring up a simple test, which any responsible, active and private life adult should be taking at least once a year. Dentist basically asked to kiss me. I knew he was gay, but it was awkward and inappropriate. I hadn't shaved in a while, was letting my stash grow out a bit. After getting my teeth cleaned by the hygienist, the dentist comes in to check. He notices the facial hair, which I normally don't have, and asks if it tickles my wife when I kiss her. I said, actually, my wife says it tickles her lips. His response was, I'd like to find out myself. Dead silence for a few minutes. The assistant looks shocked and embarrassed. I say, well, that's inappropriate, but kinda laugh it off. My 2 kids were present as well. They were 7 and 9 at the time. It's 2 separate times for me. The first, I had a doctor tell me that my pelvis was like a sewer. No idea WTH he was thinking either. I had no diseases or anything. The next, I ended having to see my mother's doctor because I thought I had a yeast infection. I'm old and this was before you could OTC treatments. He does the test and then tells my mother the results. Not the actual doctor, but whoever answered the phone at my old gym. Back when I discovered I was pregnant, I spent the night freaking out but thought, well, it's fine, I'll call my gyn in the morning because I know they do OB stuff as well. I had no idea what the next step after an at-home pregnancy test was, so I called them up, said I'm a regular patient there and I'd had my yearly literally a few weeks prior and I've just discovered I'm pregnant and wasn't sure what to do next. In a response, I got a very snotty, well, what do you expect us to do about it? We'd just give you the same test you already took at home. I just went, oh okay, and hung up. Eventually found a free women's clinic in my town which calculated how far along I was and then scheduled the first sonogram for the following week. So I guess that's what I expected them to do. You know, their freaking jobs. So I had to go to urgent care to deal with a very enthusiastic yeast infection in my lady bits. The NP kept referring to them as my down theres. Never once used the word vagina, genitals, or any other medical terminology. I have ulcerative colitis and have to talk about my to doctors quite a lot. None of them have ever referred to it as anything but the back passage, which is honestly so much weirder than using any of the billion other names for it. When I was about 14, my doctor thought that I was a little too snarky, and before she walked out of the room, while I was lying face down on the sheet, she playfully smacked my butt with her clipboard and said, too tempting, I don't personally care at all that she did this. It doesn't bother me, and I am not putting any thought into it, but even though I don't care, I'm aware of how other people would feel about that sort of thing, so still see it as a really bad idea to do that. You were 14 in a less pedophile general time. Is it the nurse practitioner who, while I was in the stirrups, sing-songed, okay, I'm saying hello to your cervix, and it's saying hello back, which I thought was odd, because it had never said anything to me? Or was it the gynecologist who said, I'm going to give you a mirror and make you look at what you did to yourself? Spoiler alert, I didn't do it to myself. Or maybe it was the male doctor who, after giving me my annual physical, started asking unnecessary questions about my private life, which ended with him telling me I must not be any fun in bed and then leering, I bet you like it dirty. Holy God. After reading all the OB-GYN experiences in this thread, I've apparently been incredibly lucky. I can't imagine having to go through that. I'm sorry you had to deal with such lack of professionalism. I had a friend experience this one. Indian accent. You have that thing that, you know. What do you say when you're pregnant? You have that thing, you know, when the parasite grows inside and you are more likely to die for a while and get blood clots. Sometimes your pituitary explodes, you know. Oh yeah, you're pregnant. Oh, you are from X country? I am from neighboring country Y. Our countries are xenophobic towards Chinese descent like us, while their own natives are all lazy and stupid. Blah blah blah. For half an hour, and that's on my first consultation, which is never repeated. You have anxiety, yes, but you really just need to stop worrying and get over whatever it is you're anxious about. Thank you, doctor. Mental illness gets short shrift all over the world. It's unfortunate, unfair, and it needs to change. Not me, but overheard by my mom who is now 90. She had pneumonia when she was 12 and was in the hospital at the Mayo Clinic since she lived near there. One morning she hears Dr. Mayo outside her room ask the nurse, oh, is she still alive? This one shocks me the most. A physician and the top of his field with no bedside manner. Granted, he might have thought she couldn't hear, but still. Nurse. Not a doctor, but same deal. Condom broke when I was 16. So I took the morning after pill and was not expecting the effects it had. Essentially induced a period that was really strange and painful. I was worried, so I called my mom and we went to the clinic. Nurse tells me this normal, to be expected, etc. But she asked about my private activity and I said I had a boyfriend and was on the pill but used condoms because there's no way I'm getting pregnant at 16. She said, why are you using condoms anyways? You're on the pill. You're in a relationship. It'll be fine. I was raised by parents who are very open and we had multiple talks about protection, STDs, all that fun stuff. So I knew I was just being extra safe. Plus, what 16-year-old takes their pills perfectly? I was absolutely shocked she thought it was a good idea to tell a 16-year-old condoms weren't necessary. I had a blighted ovum and scheduled a D&C. The nurses outside of my room were talking about how no one ever goes for the surgery. I must really not want kids. I yelled out the door that there was no baby and that I would die without surgery. They popped in and said, we know that's how women like you like to think of it, but every pregnancy is a life. So I told them to look at my ultrasounds and show me the baby. They looked, stopped talking, and left. B. Blighted ovum. I don't know what it is, but it sounds ghastly. Made my ovaries hurt, and I'm a guy. 2 years ago, I asked him if I should be worried about a bump in my neck. He felt it, got blood work, and said I wouldn't worry about it. Fast forward to present day, I'm now kicking stage 3 Hodgkin's lymphoma's butt and went through my first chemo yesterday. Always get a second opinion. He got it partially right. Many bumps are just reactions to an infection. The correct course of action is to evaluate, treat for an infection, then have a follow-up in a few weeks. If it's still present, then get a biopsy. I said I was having suicidal thoughts and severe insomnia when I was 13-14 and asked how to get a therapist or psychiatrist. He shrugged it off with, everybody's like that at your age. It's fine. 3 suicide attempts and a psychological meltdown later, I started going to therapy. I sincerely hope that you are doing better mentally today. That is an awful thing to say to a teenager, especially as a doctor. I am glad you started going to therapy, and possibly a psychiatrist, to get help. I'm bipolar. I'm also super functional and stable. I have an excellent therapist and am well medicated by a great psychiatrist, both of whom I pay out of pocket because my plan is literal crap and I resent how bad their mental health care is. I present cleanly and professionally. All that background is to clarify that nobody would ever guess my health issues without being told. Not that it matters because this should not happen anyway. Anyway, I was at the Obgyn a couple years ago and we had gone over the usual medical history, medications, etc. The nurse noticed my tattoo. It's my only one. It's fairly simple, and complimented it. I thanked her like a normal person, and she said, did you get that when you were manic, and laughed. I was steamed but didn't say anything at the time. I had to go back, got the same nurse. This time, as she confirmed I was still on the same meds, she blurted out, Lamictal? They're seriously using that for bipolar now? That's an anticonvulsant. I can't believe they're just giving medications like that out like candy now for something they can't even prove is real. That's not an exaggeration and it's very close to word for word. Which I know because I took note of it in my phone and emailed it to myself the second she left the room. First of all, B. It's been an approved mood stabilizer for bipolar patients since 2003. I'm not even going to go into the rest of why that's a completely crappy and inappropriate comment from anyone, let alone a person who's supposed to be focused on my fanny and mind her freaking business about my mental health. But okay. That time, I complained after I left. Customer service did handle it really well and assisted me in a formal complaint process and I never had to deal with her ignorant butt again. I just can't imagine I'm the first patient that's dealt with that and it was really crappy, so I hope the complaint did something. I had to get rabies shots after an incident with a bat that most likely didn't bite me, but if you know anything about bats you know their bites aren't always visible. Went to the ER to get it done and the doctor on duty told me he didn't want to. Essentially, I told him I would feel more comfortable with the shot knowing how long you can wait to see signs of rabies and how untreatable it is. I didn't want to wait 10 years to know I was okay, especially since I have pretty bad anxiety around death. He mocked me a little. Then when I said I want the shot explicitly, he said good thing you're a minor and can't make that decision and then tried to scare my already crying mother about allergic reactions, completely talking over me. Thank God my dad showed up and agreed with me, because I was in a battle. I just got a ridiculous adrenaline rush typing that up. Still angry. I was very overweight as a teenager, and I had told my doctor during a routine physical that the week before I had a horrible stomach bug and was vomiting with a high fever. She said, "Good, maybe you'll lose some pounds that way." I saw my doctor for a routine checkup. I went back a couple weeks later for something else, can't remember. In that time, I was going through a bad breakup and not eating or sleeping much. I lost around 20 pounds in just a couple of weeks. I looked like crap, bags around my eyes, bedraggled, just crappy, like someone who didn't give a crap anymore. After they weighed me, my doctor congratulated me on my weight loss, instead of questioning why her patient lost such an extreme amount of weight in a short amount of time. When I told her I was stressed out from a breakup and couldn't eat anything without throwing up, she said, "Well, whatever works." That was the last time I saw her. If I had an eating disorder or something, that probably would have killed me. I didn't even need to lose 20 pounds. And if I did, no doctor should applaud depression and stress as a good weight loss routine. These kinds of situations always freak me out, especially when there is such a devastating crossover between eating disorders and depression, anxiety, and stress. I'm glad you were able to leave. I don't consider it unprofessional, but I want to take this opportunity to say that when I had the consult for my vasectomy, the doctor grabs my testicles, leans in to take a look and says, "Beautiful." This old Indian guy is grabbing my balls and making me blush. When I got mine, the nurse that was prepping me said I did a very good job shaving and she appreciated it because it saved her the trouble. I went to a doctor for help with my weight loss, and he hit me with this gem. Well, we know everyone can lose weight, because there were no fat people at Auschwitz. While it may be true, the statement was tactless as all heck. My awful doctor's appointment I had about 3 years ago. I went to this doctor who was highly reviewed and was covered by my insurance. I show up at the office and see all these advertisements for the various weight loss stuff he's peddling. That was the first red flag. I sit down and I start filling out the paperwork. It was all pretty routine medical history stuff, and so I wasn't bothered. I was actually quite impressed that they scanned it in and it self-populated the digital chart. I hadn't seen that before. The nurse just had to go through and ask me to clarify some points and add some information, which was fine. I get to the doctor. We go into this little room and he leaves the door open. There's about 5 of these rooms on a hallway and he starts asking me many of the questions I'd already answered, but with the door open. Starts asking about health of my private life, with the door open. He never once mentions privacy or confidentiality during this time. He, without any indication from me about my political leanings, starts making aggressive comments about Obamacare and how awful it is for everyone. He makes a couple of off-color political jokes that I didn't find funny at all. He makes some comment about how, as a younger guy, I probably don't have good insurance. I tell him that my insurance fine and I'm not worried about not being covered. He apparently took that as a challenge and ordered labs that my dad, a GP, described as the most superfluous and expensive lab work he'd ever seen on someone healthy at my age. $200 worth of labs. Mind you, this was a physical. I was 25 and hadn't had one since I was 18, and thought I needed a checkup. Never once did he touch me. He checked my breathing with a stethoscope, but never actually touched my skin. He never asked me to lift my shirt, never asked me to drop my pants. It was our first time meeting. He then overcharged me for my physical. The insurance paid around $500 for a physical that should have been max $200. My dad said he was astounded. At the end of our meeting he pushed me hard to remember to write him an amazing review online. That didn't go the way he intended. Once I was at a carnival with a girl I had just started dating. It was a pretty casual event. I had also brought along my grandma and some buddies. We had just gotten done playing the see how fast you can pitch game when I notice my doctor walking towards me. At a carnival of all places. He comes right up and says, "Your test results just came in, you've got the HIV. Big time. Big time." Pretty hard to play that one off smoothly. I went to urgent care because an alarming amount of blood was coming out of my butt. Ended up being bad hemorrhoids. I was sitting in an examination room, and a male doctor walks in the door and loudly bellows out, "Bleeding from the shit you." How I said yep, and he asked me if I was sure it wasn't just my period. I told him I was sure, and he asked me how I knew, as if I don't know the difference between my fanny and my butt. Said I was having trouble with my weight. Doctor smirks at me and says, "Take your clothes off and let me be the judge of that." This was my roommate who had Crohn's. 2 examples, same hospital. First, not a doctor but still unprofessional in a hospital. Nurse came in and just said something like, "You're fat. That's your problem. How do you not respect yourself?" She was not that fat, maybe 150-160 for a 5 feet 5 inches girl. She had also been taking meds that make you gain weight. Second, my roommate was in a lot of pain from Crohn's. She called her doctor and asked if they could do pain meds, to which the doctor immediately says no and insinuates that she's just trying to get high, even though Crohn's is a very painful disease. Not to mention, she has been expressing the meds she was on felt like they were working less and less with each frequent appointment she had, which said doctor ignored. From that, she contacted the doctor's supervisor. The doctor got punished. I can't remember to what extent, but my friend was pushed to a new doctor and given pain pills. Shortly after, she started going to a new hospital. Frick that. I have Crohn's as well and it is extremely painful. Also, that nurse sounds rude. When I took meds that impacted my weight, it really took a toll on my self-esteem, and that would be awful coming from a nurse. I'm glad that your roommate found a better hospital. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.